Hello there, it's Janice Wheeler, President of the Art of Management, and I'm going to do a segment today for the front desk staff about booking appointments for patients to come back for their recalls. And there's a lot of different parts to it, so the first thing that we want to be concerned with is to make sure the person knows why they're coming back for the appointment, because we are all about giving ideal care, right? We're trying to give the patient the ideal care that they deserve to have, or the client. And so the first thing is to make sure they know what the appointment's for and why, and that it's important. Next, you want to get a time. You want to find their sweet spot or their hot spot in their calendar that will work for them. They may say, oh, I don't know where I'm going to be in 6 months, 9 months, a year, whenever the recall frequency is. And that's true, because I don't know either quite often. However, we're going to do a best guess here. I'm sure you already do this, but just a little recommendation that you say, well, look, you're here on a Tuesday today, and it's 1:30 that you came in for your appointment, so that worked for you, right? All right, so let's assume that a Tuesday at 1:30 will work with you 6 months from now, whenever the frequency is, or 1 year from now, and we'll find one. So I see July 14th is open at 1:30, and I would like to put your name in there. Does that work for you? Are you okay on that? And they say, yep, that's fine, as far as I know at this time. And you say, perfect. It has your name on that spot now. It is yours. You own it. Nobody else can have it. All right. So now I'm going to remind you about this appointment. And of course, if anything comes up where you know you're going on holidays and you see it in the calendar that you're already scheduled to be in here for an appointment, let me know. You can call me. But if you haven't called me, I still will contact you 1 month before, just to sort of check up with that. And it will either be by texting or by emailing or by a phone call. I prefer to send you a text or an email if either of those work for you. And they'll say, send me a text. Okay, good. And then all you have to do is respond to my text saying yes, and then I'll know that you're confirmed. And then I'll reconfirm you one more time, about 1 day before or 2 days before, and you have a choice. What time and which day? You want to be reminded the day before? Okay, good. And what time would you like to be reminded at? And they say, 8:30 at night is a really good time to send me a text. I'll see it. Perfect. No problem. I'll set that up. Now, very good. So we're done for today. And we'll see you on July 14th at 1:30. Okay, good. So that's the end of that. Now, let's say that you're booking an appointment for a nearby time, like for another procedure they need to come back for very soon. So again, you find their hot spot or sweet spot in the diary, same thing, and do that same Tuesday, 1:30 worked for you this time, can we do it again? And this time it's a little more important that they really put it down in their diary or their schedule or in their phone or whatever, or would they like to have an email sent to them, confirm, reminding them that they've got that date so they can put it in their calendar at home or at work, okay? So if you do that and all those steps, you will have a patient or client who usually will keep that appointment just fine. There'll be a little modifications here and there as people book holidays that they hadn't planned on, or they're sick or whatever. We're going to talk in the next segment that I do about how to handle cancellations and no-shows. So that's it for today.